Hi, Dr. Adam Mead here. I'm going to go over the simple technique of foam rolling your hips and glutes. So to begin this exercise off, you'll start off by sitting on the foam roller itself. From this position, you'll pick the side that you want to work on first. In this case, I'll bring my left hand back here to work on my left side. From this position, I'll gently lean my hips over. So now I'm putting all the pressure on the glute muscles on the left side. And from here, the motion of rolling, you'll be working on about the level of your pocket line to the belt line of your pants. So in this position, you'll roll down gently back and forth over the muscle. You may feel some tension, some soreness in the muscle as you're working through it, but this will start to melt away that muscle tightness and break through the scar tissue and adhesions that have built up in the muscle itself. Once you've done this around 15 to 20 times, or spend a good minute or two on one side, to take it to the next level, you'll bring the same leg up on the same side here, and this will get deeper into a muscle known as the piriformis muscle, which can also aggravate sciatic symptoms and pain. From here, you'll perform the same technique of rolling down and back. At times, this may feel even more uncomfortable, so you want to build up into this motion as you're working through the hips and glutes. You'll perform this on both sides around 15 to 20 times, spending a minute or two on each side of the glutes themselves. And from there, once you finish the rolling technique, you'll come back through and find maybe one of the more tight or tender spots itself and apply direct pressure. So once you've found a point of tightness or tension, you can come back to it and you'll spend a good 20 to 30 minutes holding just gentle pressure into that muscle. You can bring your legs out a little bit further if you want to reduce the amount of pressure into it, but that gentle hold will help release the tightness and tension in the glutes, continue to improve your range of motion, decreasing pain, and speeding up your recovery. Once again, this is a simple technique you can do at home on a daily basis or even multiple times a day to relieve tension and stress that's giving you back pain, hip pain, or restricting motion and flexibility. If you have any questions, let me know. I'm Dr. Adam Mead, and I wish you the best.